side room investigations in gynae emergencies. Right. There are some pretty standard ones that basically every patient who comes through a door of casualty is going to have a lot of these done by the sister by the time they see you. But I want us to put a little bit of thought into why we would want to do them. So obviously for the two patients who are bleeding, this one's bleeding outside, this one's bleeding inside, you want to know a ward HB. Definitely you want obviously a pregnancy test in these two to confirm that they are pregnant. Urine dipsticks. So acute severe lower abdominal pain is highly unlikely to be a UTI. It might fit more with this kind of ongoing suprapubic tenderness if this woman is septic, for example, but still. So UTI is on the non-gynae differentials, so everyone has a dipsticks done, but most of these are pretty obviously not going to be a UTI. So for these two pregnant patients, the HB is going to be normal or low if they've bled a lot. Pregnancy test obviously positive, and I'm talking about a urine pregnancy test, not a serum beta HCG. We are not touching a serum beta HCG. We are not anywhere near there. Let's stay in Kansas, which is here. Urine dipsticks will be clear. PID patient, the HB might be is usually going to be normal. It might be a little bit low. Pregnancy test will be negative. Women with PID cannot be pregnant, or perhaps better said, women who are pregnant cannot contract PID. They cannot develop PID. So the pregnancy test is going to be negative. A urine dipsticks might be normal, or there might be a little bit of protein or leukocytosis, which could be coming from the vaginal discharge. Then your ovarian torsion patient, the HB will be normal, pregnancy test is going to be negative, and the urine dipsticks will be normal. So sort of ways to differentiate things. These two are probably going to have a low HB. These two will probably have a normal HB. This is the only one who's likely to have any findings in the urine, whereas the others are going to be negative in terms of urine dipsticks. And these two are definitely going to have a positive pregnancy test. So in the situation of lower abdominal pain that is acute or sort of semi-acute, in somebody who's sexually active, you always want to do a pregnancy test because that very clearly helps you divide your differential. Okay, next stop, how are you going to manage these patients?